Yeah.
Okay. So this doesn't need to close or anything?
No.
Okay.
Focus it on me and make sure you see
Oh,
that.
yeah. You can look forward a bit too so you can hear me. Oh.
Hi there.
Hi.
How are you doing?
Good. I just want to get this prescription filled.
Sure.
Please.
So my name's Brian White. I am a pharmacist here at the pharmacy.
Okay.
Alright, and could I just grab your name for a moment?
It's Connie Altman.
And could you just confirm your date of birth for me?
February 15th, 1948.
Perfect, thank you. So besides this prescription for Vaxxin, is there anything else I can help you with today?
That's it.
No? Okay. Alright. So you have a prescription for Vaxxin XL, 1,000 milligrams. Alright. So I'm just going to quickly just go through your med history and medications just to make sure this
Sure.
we have everything. So what medical conditions do you currently have?
Well, the ones I take my meds for, blood pressure, lipids, thyroid, asthma.
Okay. Correct. Thank you. And for your medications here, I see you have refills coming up for that, so just aware of that. No, perfect. So for the Vaxxin, why were you prescribed the Vaxxin?
I have a chest infection.
Chest infection? Okay. And how long ago was that diagnosed?
Like just today.
Just now?
I started getting colds a week ago, and then I started getting a cough, and then now I'm actually starting to cough, phlegm up, and
Okay.
so I thought it was a cold, and then it was getting kind of worse. So I went to the doctor. I have a chest infection.
Okay. Alright. So have you tried anything yet?
I tried just some cough syrup. It didn't get rid of anything.
Right. So I see you have a prescription for Vaxxin, which is clarithromycin.
Mm-hmm.
Now I noticed that you are taking atorvastatin, correct?
Yeah.
For your cholesterol.
Yeah.
Now there could be an issue with this because Vaxxin it's called a macrolide.
Okay.
So it's a drug that can interact with atorvastatin, increasing its levels because it blocks the metabolizers, which is naturally higher.
Okay.
So that's the thing we want to kind of watch out for. So we kind of have a few options what we can do with this.
Okay.
So we can contact your doctor and ask to be put on a different medication. I think azithromycin might be you could use, right? Because it hasn't really been shown to be for this or for that metabolism enzyme to show effect.
Okay.
So we could do that as an option, or look for other drug therapies that doesn't interact with atorvastatin. Or the other option, which is I think is kind of might be a little bit more difficult, is to switch you off atorvastatin onto something else that isn't metabolized, so like rosuvastatin or pravastatin.
Okay.
So we could try doing those things, but the issue is because you're are you stable right now for your?
Yeah, I've been stable for about 5 years now, my lipids, so.
Okay. Alright. So between those two options, would you rather just have a different prescription, or?
Well, I mean, I've been taking my Lipitor forever, so I don't really want to switch that.
Okay. Sure. So what we can do is we can contact the doctor, and he can write us a new prescription for that, and find something that is I guess, better suited for the therapy for the chest cold. So, I guess I should look up that. So, would you mind going back to see your doctor, or?
Well, I'd like to just be able to start taking something right away to relief. But
so,
how long am I taking the antibiotic for?
This one is for 10 days.
Okay. And what happens what would happen if I took them both?
So if you I'll check out that side effect. 1 moment. Because I'm pretty sure you'd get muscle weakness. Is kind of.
Go ahead, keep going. That's right.
Alright. You'll get muscle weakness, which is the big one, and so you just be very kind of like I think it attacks with like damaged tissue and increases its breakdown.
Okay.
So you don't really want to take them together. Like it is a very short duration, but I'd rather be safe than sorry.
Okay.
That's alright with you?
Okay.
So yeah, so it's myopathy is the term to use. Now looking at your other medications, it should be fine with the other ones. So Torsen's only one you're concerned with. So is it alright if I maybe fax a suggestion to your doctor and then get his opinion and then send back? Okay. So first, your doctor. So this might take a little bit of a while. How much time do you have?
A little while. I can probably wait.
You can wait? Alright. Well, I'll send this, I'll write a prescription and then send it to your doctor, and depending on the waiting, hopefully we'll have it ready for you today.
Okay.
Alright, so could I get your number?
I think you have it on file there.
Okay, I'm just going to confirm it with you, the 780XX. X8957?
Yeah.
Okay, sure. So just in case that for some reason the office is closed or anything that we need to contact you,
Okay.
and we can have it ready first thing tomorrow.
Okay.
Alright, so that's that. Chest infection. Yeah, so sorry about that, but definitely talk to the doctor. Right. Thank you. I'll call you when the prescription's ready.
Okay.
Thanks.